If you've been told your parent needs an ACAT assessment, you're probably wondering what that actually means. And if no one's mentioned it yet, but you're starting to think about aged care, this is the first thing you need to know about. So let me walk you through it. ACAT stands for Aged Care Assessment Team. In some states it's called ACAS, but here in Perth it's ACAT. It's a free government assessment that determines what level of aged care support your parent is eligible for. Think of it as the gateway. Without an ACAT approval, your parent can't access a support at home package. They can't move into residential aged care and they can't access respite. It all starts here. So how does it work? First, someone needs to make a referral through My Aged Care. That can be you, your parent, their GP, or a hospital social worker. You'll call My Aged Care or go online, answer some questions, and they'll arrange for an assessor to visit. The assessment itself usually happens in your parent's home. An assessor, typically a nurse or allied health professional, will spend about an hour with your parent. They'll talk about how they're managing day to day. Can they shower safely? Are they eating properly? Can they manage their medications? Are they at risk of falls? They're looking at the whole picture: physical health, cognitive function, emotional well-being, and what support is already in place. Now here's something important. The assessment isn't a test your parent can pass or fail. It's not about catching them out, it's about understanding what help they actually need. But I will say this, I've seen many parents who put on a brave face for the assessor. They tidy the house, they say they're managing fine, and then the assessment comes back with a lower level of approval than the family expected. If you can, be there for the assessment. You can provide context the assessor might not see in a 1-hour visit. Things like Dad had 3 falls last month, or Mum's been leaving the stove on. After the assessment, the team will approve your parent for a level of care. That might be a support at home package, which means funded support to help them stay at home. It might be residential respite, which is short-term care in a facility, often used after a hospital stay or to give the family a break. Or it might be permanent residential care, which is what most people think of as a nursing home. The approval letter will tell you what they've been approved for, and it's valid for 12 months. You don't have to act on it immediately, but it does need to be in place before you can access services. Here's what I tell every family. Don't wait for a crisis to get the ACAT done. If you're starting to notice changes, if things are getting harder, get the assessment now while there's time to plan. Because when a crisis hits and your parent is in hospital and the discharge team is asking whether they have ACAT approval, that is not the moment you want to be starting this process. The ACAT assessment is free, it's government funded, and it's the single most important step in accessing aged care in Australia. If you're not sure whether your parent needs one, that's probably a sign they do. If you need help navigating the ACAT process or understanding what your parent's approval means, visit wrightagedcare.com.au. We help families through this every day. Drop your questions in the comments below and I'll do my best to answer them. And remember, you don't have to figure this out alone.